Hello, welcome to ANA community. What do you mean by Anumana? What is the word meaning of inference? What are the applications of Anumana? How we are going to understand in terms of the clinical medicine and in terms of the real life experiences we are going to learn in this particular video. Dear community, put a thumbs up button and spread this particular video to maximum number of true Nidana learners and click a bell icon so that the YouTube algorithms will fetch you the right information for the right time. When you think about the Anumana Pramana, Charaka Vimana 4th chapter describes about this. Ime tu khalvane api evameva bhuyo anumanadneya bhavanti bhavaah tadyatha agnim jaranashaktya pariksheta balam vyayamashakya श्रोत्रादीनि शब्दादि अर्थग्रहणेन मनो अर्थाव्यभिचरणेन विज्ञानं व्यवसायेन रजः संगेन मोहम् अविज्ञानेन क्रोधम् अभिद्रोहेण शोकं दैन्येन हर्षम् आमोदेन प्रीतिं तोषेण भयं विषादेन धैर्यम् अविषादेन वीर्यम् उत्थानेन अवस्थानम् अभिभ्रमेण श्रद्धाम् अभिप्रायेण मेधां ग्रहणेन संज्ञां नामग्रहणेन स्मृतिं स्मरणेन ह्रियम् अपत्रपणेन शीलम् अनुशीलनेन द्वेषं प्रतिषेधेन उपधिमनुबन्धेन धृतिम् अलौल्येन वश्यतां विधेयतया वयोभक्तिसात्म्यव्याधिसमुत्थानानि कालदेश उपवशय वेदनाविशेषेण गूढलिङ्गं व्याधिमुपशयानुपशाभ्यां दोषप्रमाणविशेषम् अपचारविशेषेण आयुषः क्षयम् अरिष्टैः उपस्थितश्रेयस्त्वं कल्याणाभिनिवेशेन अमलं सत्त्वम् अविकारेण ग्रहण्यास्तु मृदुदारुणत्वं स्वप्नदर्शनमभिप्रायं दुष्टेषु सुखदुःखानि च आतुरपरिप्रश्नेनैव विद्यात् इति. If you split this particular shloka, ime tu khalu anye api evam eva bhuyo anumanadneya bhavanti bhavah tat yatha agnim jaranashaktya pariksheta balam vyayama shaktya श्रोत्रादीनि शब्दादि अर्थग्रहणेन मनो अर्थ अव्यभिचरणेन विज्ञानं व्यवसायेन रजः संगेन मोहम् अविज्ञानेन क्रोधम् अभिद्रोहेण शोकं दैन्येन हर्षम् आमोदेन प्रीतिं तोषेण भयं विषादेन धैर्यम् अविषादेन वीर्यम् उत्थानेन अवस्थानम् अविभ्रमेण श्रद्धाम् अभिप्रायेण मेधां ग्रहणेन संज्ञां नामग्रहणेन स्मृतिं स्मरणेन ह्रियम् अपत्रपणेन शीलम् अनुशीलनेन द्वेषं प्रतिषेधेन उपधिम् अनुबन्धेन धृतिम् अलौल्येन वश्यतां विधेयतया वयोभक्तिसात्म्य व्याधिसमुत्थानानि कालदेश उपशय वेदनाविशेषेण गूढलिङ्गं व्याधिम् उपशय अनुपशयाभ्यां दोषप्रमाणविशेषम् अपचारविशेषेण आयुषः क्षयम् अरिष्टैः उपस्थितश्रेयस्त्वं कल्याण अभिनिवेशेन अमलं सत्त्वम् अविकारेण ग्रहण्याः तु मृदुदारुणत्वं स्वप्नदर्शनम् अभिप्रायं द्विष्ट इष्ट सुखदुःखानि च आतुरपरिप्रश्नेन एव विद्यात् इति. This video may go a little bit longer. Whenever if you think about these are the different parameters we are going to analyze by Anumana or inference. Whenever if you think about the first point, that is Agnim Jaranashaktya Pariksheta. So that is the Jaranashakti refers to the digestive capacity. Once the digestive capacity, it is actually helpful in analyzing the Agni or digestive fire, status of the digestive fire, whether the person is having the poor Agni or whether the person is having the very strong or powerful Agni, etc. That is we are going to analyze that. So whenever if you think about the Jarana Shakti as such, we need to know about the gut to transit time. The term gut to transit time refers to the movement of the food substances in the alimentary canal. The food will be present in the mouth for a period of 2 or 3 minutes, wherein the swallowing will be responsible for the transport of the food from mouth to esophagus, wherein the esophagus will be transporting the food within seconds into the stomach, wherein the stomach may be responsible for the stasis of the food for a period of 2 hours or so. That too in the upper below 1/2 of that. That is considered to be the area where food will be remaining in the amasha, or what we can say the stomach as such. From there, the food will be entering into the small intestine, where the food may remain for a period of 6 hours or so. And in the large intestine, the ingested food, after entering into the large intestine, the food may remain for a period of 24 to 48 hours. So with this amount as such, that is with this the time period, the food will be remaining in the different parts of the alimentary canal. Of course, certain other factors, they are actually determining the status of the Agni functioning, such as what is the prakriti of the individual. If the person is having the Pitta prakriti, he will be having the digestive fire, very Tikshna digestive fire, that is Tikshna Agni will be there, wherein the food may get digested within short possible amount of time. Or what kind of the mental impact or emotional lability is being present while consuming the food. Suppose if the person is mentally stressed, naturally, so that will be responsible for the reduced digestive fire activity. Plus, even what kind of the food the person is consuming, that is also determining. So that is what a person is going to take the food and what he is actually doing. Whether he is seeing the television, or whether is he watching the movie, or whether he is traveling in a train or so. So that is also considered to be determining the Agni also. And what kind of the food he is consuming. Whether he is consuming more amount of the Madhura rasa substances, or more amount of the Katu rasa substances, or more amount of the Amla rasa substances, etc. etc. Not even in the type of the food, even quantity of the food in different gunas also. For example, Shita food substances, if he is consuming up to 5%, that is having the different impact on the functioning of the Agni. 50% of the Shita guna substances, that will be leading to the totally different activity as such. 80% of the Shita food substances, they are responsible for the overall the different the functioning of the Agni as such, that we are going to observe. And plus, what kind of the activity a person is doing after the food consumption, that is also determining the functioning of the Agni. For example, whether he is studying or not, or whether he is traveling or not, so that is we are going to observe that. Whenever if you think about the Jirnahara Lakshana, textbook says Udgara Shuddhirutsaho Vegotsargo Yathochita Lagutakshat Pipasa Cha Jirnaharasya Lakshanam. Udgara Shuddhihi, the person will be having the belching, which is not having the similar taste as the food he is consuming. Utsaha, he will be having the proper enthusiasm to do any kind of the activity. Vegotsargo Yathochitaha, proper the movement of the Vega that is going to take place, maybe Adhovata or Purisha or the Mutra, etc. etc. Laghuta, lightness of the body will be observed. Kshatapipamasacha, so the person will be getting the hunger at appropriate amount of time as such. So these are the different factors which are determining the functioning of the Agni. When you think about the Balam Vyayama Shaktya Pariksheta, so that is the doing the Vyayama, so the degree of Vyayama will be determining the Bala of an individual. Whenever if a person is doing any kind of the Vyayama, these are the following the physiological events they are going to take place. That is proper movement of the ingested food that will be happening. In the sense, the person will be having the peristaltic activity that will become normal, both in the upper alimentary canal as well as lower alimentary canal. Then the person will be having the proper circulation of the blood in different parts of the body tissue. If the person is having the nutrients are going to get depleted, so that will be responsible for the stored fat in the adipose tissue, which are getting converted into circulating fat. In the meantime, because of the metabolic activities, heat generation may be possible during the, what do you say, that the vyayama as such, during the metabolism. Plus the balardha lakshana. When the person is getting the balardha lakshana refers to the Sushruta Chikitsa Dalhana says, Kakshalalatanasaasu hastapadadi sandhishu prasvedat mukhashoshacha balardham tadhi nirdishet. So that is Kakshalalatanasaasu. So these are the Kaksha. So that is axillary region. Lalata, forehead region. Nasa, on the either sides of the nose as such. If the person plus hastapadadi sandhishu, in different joints, both upper limb and lower limbs, if the person is having the sweating associated with mukha shosha, that is dryness of the mouth, then we are going to say the person has attained balardha. So another reference, Shruta Chikitsa says, Hridistana sthito vayuh yada vaktram prapadyate vyayamam kurvato jantoho tad balardhasya lakshanam. So wherein the vayu present in the Hridaya Pradesha, if that is entering into the vakram, different parts of the body, so that is considered to be balardha lakshana. So this is the reference in relation to the vyayama. Suppose if the person is doing 10% of vyayama and he is getting the balardha lakshana, that is considered to be avara vyayama shakti. If the person is, for example, if the person is doing the vyayama up to 40% and he is developing the balardha lakshana, then it may indicate madhyama pala. And if the person is doing the 60% of the activity, and if he is developing the balardha lakshana, that may indicate pravarabala as such. So this is how the vyayama shakti will be helpful in determining the bala of an individual. Then comes Shrotra adini shabdadi arthagrahanena. When you think about Shrotra adini shabdadi arthagrahanena, Shrotra adini refers to the Jnanendriya as such. Shrotra, Sparsha, that is Tvak, Chakshu, eyes, then Grana, nose, Rasana, tongue. All these are actually, if they are doing their activities properly, then that is, we can able to analyze by perceiving the proper Shabda, Sparsha, Rupa, Rasa and Gandha. Let us say, for example, Shrotra Adini and Shabda. Shrotra and Shabda, let us take. The person able to hear loud sound. The person able to hear shrill sound. The person is able to hear whispered sound. The person able to identify the sound of the loud ones even in the crowded railway station also. So, whereas the person who is not able to analyze or perceive the sounds, that may indicate disturbance in the Shrotra as such. The same thing you have to apply to Tvak, that is the skin, and Chakshu for vision as such, Jikhva for taste perception, and Nasa for smell perception. So, like that, if the person is able to analyze or appreciate all these different varieties of the sounds, then that is indicative of the proper functioning of Shrotra, etc. Whereas if the person is able to perceive different touch perceptions, it may indicate the person is having the proper Tvak Indriya function. Whereas if the person is able to visualize different objects through the eyes, that may indicate properly functioning chakshu. If the person is able to perceive the different tastes, then that may indicate properly functioning jihva or tongue. Different smell perception accurately if the person is doing, that is indicative of properly functioning nasa. In that way, so the Shrotra, etc., that can be analyzed by their respective indriyartha perception. Mano artha avyabhicharanena. So here, mano artha avyabhicharanena, in the sense, the proper functioning of the mana itself. So when you think about the left example, let us say if the person is coming to the clinic as such with this particular presentation, wherein the lower limb is the left, the lower limb is on the what do you say, that the circumduction fashion, whereas upper limb is in this particular way. That means straight away the physician can make the diagnosis of a cerebrovascular accident or pakshaghat. So that means here the presence of the mind that will be tested. So if the person is able to perceive this, then it is indicative of he is having the topmost mano artha function as such. Let us take one more example in real life situation. The person is driving the car, and if the person is having the listening to the music while driving the car, in the sense, so if the person is able to put a brake, if some object comes in between, that is indicative of the presence of mind despite is listening to the music. In that way, the Anumana Pramana will be helpful in determining the status of the mind in such situation. Certain other examples, that is the seeing the vegetables and cutting the vegetables, that is considered to be presence of mind itself. While cutting the vegetable, if the person is cutting the finger, that is indicative of the deviation of mind from one activity to other. Whereas the third example, listening to the music and walking in the park. So that is the listening to the music that is related to the Shrotra, and walking in the park that is related to Pada. So that is indicative of if the person is able to walk properly, then it is indicative of the presence of mind as such. If the person falls, then it is indicative of deviation of the mind from the activity as such. Vijnanam vyavasayena. So that is the one's knowledge will be tested by the way of their occupation or activity. For example, here there is an example. If the person is doing the agricultural activity. So if you are asking any of the questions as such as how much amount of the water is required, how to put the plants, how much depth it has to be, how much depth you have to keep the plants to have the proper crops as such, and how much amount of sunlight is required to have the proper growth of these crops as such. So that is considered to be if the person is able to answer that, then it is considered to be he is having the proper knowledge regarding his occupation as such. Let us take one more example. So here he is doing the truck driving. So in the sense, so what is the mileage of the truck in case of the fully loaded truck as such? What may be the mileage in case of the empty truck as such? And what is the status of the tire? Whether is it considered to be any kind of the damage is being present or not? Is it possible to predict how much distance it has traveled, etc.? So if the person is able to say that, then it is indicative of he is having that particular occupation for longer amount of time. So like that, let us take the example of the dermatologist as such. What are the different clinical features of atopic dermatitis? What are the different clinical features of atopic eczema? Or what are the features of psoriasis, pemphigoid, etc. In terms of the Ayurveda, what are the clinical features of Kapala Kushta, Mandala Kushta, Sidma Kushta, etc. When do you say the person is having Asadhya Kushta, etc.? The person is able to give the answer. In the sense, he is having the proper Vijnana as such. If the person is not able to give the proper answer, that is indicative of he is not having the proper Vijnana as such. So, this is how we are going to test the Vijnana. Rajaha Sangena, in the sense that is considered to be the proper, what do you say, that intimacy as such, or what we can say, the passion towards one particular activity. So here, that is the Chakrapani says, Rajaha Sangena, Naryadi Sangena, Tatkaranam Rajo Anumiyate. So that is, it is actually indicative of, in this particular example, the attraction towards the opposite gender. So that will be giving us the how far he is able to attract towards the opposite gender. So that will be deciding the Rajaha. If the person is having the another example, let us say, whether regarding this can be attributable to the passion as such. In the sense, if the person is getting up from the bed, if the person is able to do the activities, how far he is able to do the activities regarding those as such, that will be deciding the Rajaha as such. What we can say, the high priority action. If the person is able to do his high priority action in the early morning itself, so that may indicate Pravara Rajaha as such. If the person is able to do the activities late night as such, that means it may suggest low priority activity as such. In this way, Rajaha can be analyzed by the nature of the Sangha as such, or what we can say, passion, or the, what we can say, the attraction as such. Moham avidnyanena. So the moha is being analyzed by avidnyana. Avidnyana refers to lack of knowledge. Here the person is a doctor, and if he is having the questions by the common public regarding the principles of machine learning, he may not be in a better position to give the appropriate answer than an engineer gives. Certain other examples, for example, agriculturist, if you are asking the questions related to political reforms, they may not be in a better position to give the answer as such. So that is indicative of lack of knowledge as such. For example, gynecologist, if you are asking the questions regarding the cardiac surgery, they may be in a position to give the answer, but the deep answer as such, the gynecologists are not in a position to give the information on cardiac surgery. Or otherwise, banking employee, if you are asking the questions regarding Ayurveda treatment, that means he is having the lack of knowledge or ignorance, so that they may not be in a better position to give the accurate knowledge regarding the Ayurveda treatment as such. So like this, the moham, so that is the confusion, etc., that is going to get analyzed by avidnyana. Krodham abhidrohena. So the term abhidroha refers to parapidartha pravrittihi, in the sense the activities which are doing the harm to other people. For example, if the person is going to do the simple slap to the other person, that may indicate he may have alpa krodha when compared to slapping, kicking, or using the abusive language to the other person, which may indicate prabhuta krodha. So that is, it is considered to be the Krodha will be to the highest extent as such. In this way, the Krodham Abhidrohena, that is, the anger is going to get analyzed by the nature of the activities which actually does harm to other people. Shokam Dainyena, in the sense, the Dainyam refers to Rodanadi. Rodanadi, in the sense, the person is going to do the gloomy face or crying as such, that may be done, or is not going to speak with anybody, or always seeing downwards, etc. So they are going to analyze. So that will be giving us the knowledge regarding the shoka. For example, in case of the financial loss or loss in business, or some other examples such as loss of a dear and near ones, or when any undesirable thing happens, or when getting scolded by the higher authorities, etc. So that will be giving us the shoka. That is the, what do you say, that the grief we can able to observe. The maximum extent the person may have the suicidal tendencies, whereas the krodham, the maximum, what do you say, that the maximum impact of krodha may be resulting in the homicide. Harsham amodena, in the sense, amodaha nritya gita vaditradi utsavakaradam. So that means celebrating the events as such as dancing, singing, or making various kinds of the sounds as such. For example, the getting the married, or otherwise getting promotion in the career, or the extension of the family is happening by the birth of a baby, etc. So these are the different activities wherein the person may be showing the harsha as such. So that is, the people are doing the various kinds of the activities. Whereas the mild harsha, in the sense, the activities will be for a limited period of time. Madhyama, in the sense, maybe the 3 or 4 hours or so. Whereas the pravara harsha, maybe throughout the day the person will be having the, what do you say, that the amuda type of the activities, that is indicative of harsha as such. Pritim toshena, so that is the tosha mukhanayana prasadadihi, that is mainly related to the facial expressions as such. So, or otherwise having the smiling face as such. They are not doing any kind of the dancing movements or any kind of the sounds, etc. That will not be observed here. Only that is indicative of the toshaha. So that will be giving us the assessment of preeti as such. Bhayam vishadena. Whenever, if you look into that, so the facial expression will be somewhat like this. Bhayam vishadena, where the, for example, seeing the lion in front of you, or seeing the cobra in front of you, or the seeing the very powerful individual who is doing the harm to you, if you are looking into that as such. So that is actually, we can see the bhaya of the bhaya assessment as such. Dhairyam abhishadena, the ability to do the activities despite having fear. I may fail, but I will do the activities by today itself. In the sense, I may be able to, I may not able to do this, but still I will do that activity. I may lose the money, but still I want to do the activities as such. So that is actually telling us the dhairyam as such, aveshadena, that is ability to do the activities. So this particular image gives us the perfect example for dhairya. Viryam utthanena, in the sense the person is doing the activities and that is consistently. That is, he is initiating the activities and that activity will be done continuously. Whenever if you think about it, so the perfect example is here we can able to see the watch as such. For example, if you start doing the activities like that, certain other activities are also getting accomplished. For example, that is the writing 2 pages per day. If you start doing that, by the end of the 30 days, we are going to complete 60 pages. By the end of the 180 days, we are going to write 360 pages. So like that, reading 10 pages a day. In 30 days, we are going to read 300 pages. And in 180 days, we are going to read 1800 pages as such. So that means Viryam that is going to get analyzed, that is Arabdha Dushkara Karyeshu Avyavrittihi Manasaha. So that is difficult activities we are going to do consistently. So that means we are going to do the activities in chunks. So that means of a small activities as such. Suppose if the person is continuously doing that, then we may suggest or we may infer he is having the pravaravirya. Suppose if the person is doing the activities for a period of 1 or 2 days, then after that he is going to do the activities. After a matter of 7 days later, again he starts doing activities for 1 or 2 days, etc. That may indicate he may have avaravirya. Avasthanam avipramena. So that is avasthanam refers to the stiramatitvam. Stiramatitvam in the sense a stable mind. Whereas avibhramena, that is abhrantya. So that means, let us take the example of the dermatologist, skin specialist as such. He will be having the clear state of the skin diseases as such. He may be knowing different skin diseases. He may be in a better position to say, if he is an Ayurveda specialist, whether it is Sama stage or Nirama stage, that can be very well be identified. Which particular dosha dominance is being observed in case of that particular skin disease, whether is it Vata dosha or Pitta dosha or Kapha dosha, that can be very well identified. Which particular dhatu is being affected, whether is it Rasa dhatu or Rakta dhatu or Mamsa dhatu or Medo dhatu or Asti dhatu or Majja dhatu, Shukra dhatu affliction, he can able to analyze it. What is the exact physical strength of an individual? How far he is able to withstand the potency of the ingested medicine, the person able to visualize. And how far he can able to withstand the potency of the medicine, even that can able to visualize. Certain other examples such as traffic policeman. He may be exactly knowing what are the different, the do's and don'ts if he is standing in front of the traffic areas as such. Lawyer, I said, they may be knowing what actually their capabilities are, and based on that capabilities they are going to do their activities. That is indicative of the avibhrama, that is the avasthana can be analyzed. Whereas the teacher, etc., they may be knowing what are the weaknesses of their students, how that particular information can be conveyed to the students in an even much better way, etc. That is we are going to assess the avasthana of an individual. Shraddha abhiprayena, in the sense Shraddha refers to ichcha abhyartanena, that is the giving the opinions. Suppose if the person is frequently giving the opinion related to knee joint as such, or the person is giving the opinion related to the cerebrovascular accident, then we may suggest the earlier example, he may be the orthopedician. The second example, he may be a neurologist. Like that, we can able to infer. Or otherwise, the chess professional playing international tournament. It is that is considered to be their interest as such. That is Supreme Court lawyer practicing law in Supreme Court. And if these people are coming in the general public, we can able to identify their Shraddha by what kind of the opinions they are giving. So that means the opinions of the specialist matters a lot than the generalists. Medham grahanena, in the sense the granthadidharanena. Grahanena refers to the holding the what are the points that are being told in the textbooks. For example, in the Miracle Morning, the book written by Hal Elrod, the main the content of this particular book is Savers technique. That is practicing Savers, silence, affirmation, visualization, exercise, reading and scripting. Let us look into the other example, the Granthadidharana in terms of the Charaka Samhita. The contents of what you say that the Srotodushtikarana, contents of Jvara, contents of what you say that the Krimi, contents of the Laghu Vyadita and Guru Vyadita, etc. That is considered to be the internalizing those informations. That is, we are going to assess the medha of an individual. Samnyam namagrahanena. So that is, this is an image of the stethoscope. This is used for hearing the breath sound, hearing the cardiac sound, hearing the abdominal sounds or peristaltic sounds, hearing the fetal heart sounds, etc. So the samnyam namagrahanena, so that is by able to, if the person is able to do the naming of this particular object, then we may say that he is having the prabhara samjna. Suppose if the doctor is not able to identify this particular object, then it may suggest he is having the abhara samjna. Whereas this particular image, that is considered to be a pen, if the person is an author, he is not able to give this as the pen, that may indicate he is having the abhara samjna. Whereas if the person is able to say that this is a pen, then we may say that he is having the prabhara samjna. So like that, samjnam namagrahanena. So that is, samjna of an individual is being analyzed by the capacity of giving the naming of the objects as such. Smritim smaranena. Smritim iti smriti janakam samskara. Smaranena iti tatkaranam samskaro anumiyate. So that is, suppose if the person is coming to you with a history of pain in this particular region, he has developed this particular pain previously also. So this particular pain, he is able to memorize this particular pain was aggravated while climbing the stairs. And this particular pain was getting relieved by taking rest. This is indicative of the person may be having the cardiac pain as such. This is how we can able to analyze one's memory capacity. So the right example. So if a person is a gardener, he may be in a better position to say, this is a jasmine flower. This is considered to be having the very pleasant smell, and like that, this may require little amount of water for the proper growth as such. If the person is able to say that, so that is indicative of assessment of the smriti for the gardener as such. So the gardener, until and unless if the person is not having these kinds of the presenting complaint, he may not be in a better position to, what do you say, that give the smarana of these particular activities. So like that, here the assessment of the smriti will be done in this way. Hriyam apatrapanena. So that is hriyam iti lajja. Apatrapanena iti lajjitakarena. So that is, if the person is considered to be having this particular pain and the doctor is making the wrong diagnosis of neurological chest pain, that means that may be considered to be the somewhat considered to be the ashaming incident may be possible. And whenever if you think about this particular kind of the facial expressions, etc., for example, pain in the perianal region, etc., then it is indicative of Hriyam. What we can say, the Lajja assessment can be done by these kinds of the body postures. Sheelam Anushilanena. Sheelam iti Sahajam Vastushu Ragam. So that is the continuous, consistent activities. So what we can say, the habitual activities, that is repeatedly observing, that is the pattern of activities, then that is indicative of that can be analyzed by Anushilana. Anushilana in the sense that repeatedly performing activities. For example, if the doctor is consistently visiting to the hospital at regular amount of time, that is indicative of he is having the proper Shilana in terms of the visiting to the hospital. Other examples such as lawyer visiting to the court in time to have an argument as such, that is in the indicative of Shilana in terms of attending the court at proper amount of time. Bank employee visiting the bank regularly at 10 a.m. in the morning, that is indicative of Shilana in terms of visiting to the bank at regular amount of time consistently. So like that, Shilana is analyzed by the repeatedly occurring events as such. Dvesham pratishedhena. Pratishedha in the sense doing the harm to the others with the intention of doing the harm to the others. That is giving us the dvesha, analyzing the dvesha by these kinds of the activities. Upadhim anubandhena, in the sense the upadhihi, that means he is actually remembered by the kind of the activities they are going to do. For example, if the person is heart specialist, certain doctor is heart specialist, he may not be called by the name, he may be called by the name heart doctor or heart specialist or pediatrician, child specialist or gastroenterologist, GIT specialist. Sometimes in kinds of the other activities such as divorce lawyer, who is doing the frequently the divorce of the couple as such, child counselor or botanist, who is considered to be doing the work on the plants continuously. So like that, upadhim anubandhena, by the kind of the activities they are going to do, their naming is being, or what kind of their profession, etc., that can be assumed by the kind of the naming as such. Dhritim alaulyena, that is stubbornness or stableness, that is going to get analyzed by the alaulyata. Alaulyata in the sense that is considered to be the stubbornness in the activities. So here there are two examples. Here two children are sitting there. Extreme left child, he has lot of the chocolates in front of him. Still, he is not taking even a single chocolate itself. That is indicative of pravaradhriti. Whereas second child taking the chocolate itself by the immediately, that is indicative of avaradhriti. Avaradhriti in the sense not having the control over their indriya. Vashyatam vidheyataya. Suppose the person is coming to you with a history of cerebrovascular accident. He is having the complete submissiveness to the doctor. That is indicative of the vashyata of an individual. That is, he is willing to do the physiotherapy as directed by the clinician. The patient is willing to do the abhyanga or basti or rasayana therapy, etc. If the person is doing every kind of the activity as directed by the clinician, that is indicative of a pashyata to the physician as such. That is, he is having the complete submissiveness to that particular doctor. If the person is saying, I can able to take only the rasayana therapy, I cannot able to go for the abhyanga or basti as such, that is indicative of partial vashyata as such. The person is able to do only the 10 minutes physiotherapy as such. In that particular situation, is not able to follow all the instructions given by the particular physiotherapist. That is indicative he is having the partial vashyata as such. So like that, the vashyata of an individual is going to get analyzed. Vayam kalena. Suppose the person is the child and it is presented with this kind of the clinical presentation, that is running nose, etc. That is indicative of the kapha pradhana vikara. Whereas the person who is considered to be the elderly, for example, 40 years or 50 years, that is indicative of pitta pradhana vikara. If the person is having the 60 plus and if he is developing the joint pain, etc., that is indicative of vata pradhana vikara. So like that, vaya of an individual can be analyzed by the kala. Bhakti deshena. So that is deshena bhakti riti ichha jnayate. For example, this is considered to be the samosa, and this is considered to be the most of the people of the Purvanchal region are going to consume this particular type of the food substance, staple food as such. Whereas the lassi, if the persons are consuming that, that is indicative of most of the occasions the people of Punjab region, they are going to consume lassi most of the occasions. So that means they are having the liking towards that particular substances. So that means samosa is being liked by the people of the Purvanchal, whereas lassi and other milk products are liked by the people of Punjab region. This is how we can able to analyze the bhakti as such. Satmyam upashayena. In the sense, the satmya, that is homologation, that is going to get analyzed by the upashaya as such. For example, the person is suffering from pitta dominant disease, and if he is getting the improvement in consumption of madhura rasa substance or kashaya rasa substance or tikta rasa substance as such, that is indicative of he is homologation, he is having the satmya towards the substances over tikta, madhura and kashaya rasa substances. Whereas vata dominant disorder individual, they may have the satmyata towards madhura, amla and lavana rasa substances. Kapha dominant disordered people are having satmya, that means improvement in the consumption of katu tikta and kashaya rasa substances. So like that, so that the satmya is going to get analyzed by the upashaya as such. Vyadi samuttanam vedana visheshena. In the sense, the onset of the disease is going to, we are going to analyze by the nature of the clinical presentation. Suppose the person is having the sneezing. Person is having the sneezing for 1 hour or so, and we may suspect he has consumed dahi. So that is indicative of the avara samuttana as such. Suppose if the child is having the sneezing for more than 3 hours or 4 hours, that may indicate he has consumed 2 or 3 glasses of dahi as such. Suppose if the child is having the sneezing throughout the day along with the coughing as such, that may indicate he has consumed more amount of the dahi continuously. 3 or 4 days he has consumed dahi as such, that we are going to analyze. Like that, Vyadi Samuttana is analyzed by the nature of a clinical presentation, or what we can say, the cause of the disease can be identified by the nature of a clinical presentation. Gudalingam Vyadhim Upashaya Anupashayabhyam, that is the diseases which are having the unclear signs and symptoms, we are going to analyze by upashaya and anupashaya. For example, if the person is applied oil towards the joint as such, if he is getting the improvement in the symptoms, that is indicative of nirama stage of vata. Whereas if the oil application that is actually worsening the pain, that is indicative of sama stage of the vata dosha. So like that, gudalingam vyadhim upashaya anupashayabhyam. So that is like that we can able to analyze. Dosha pramana vishesham apachara visheshena. The degree of the dosha vitiation we are going to analyze by the apachara, that is the degree of nidana sevana. Say for example, whenever if a person is going to consume this much amount of the, the madhya, he may have the mild pitta dosha prakopa. If the person is going to consume this much amount of the madhya or alcoholic beverages, the person may have pravara pitta dosha prakopa. If the person is going to consume this much amount of the madhya, the person may have madhyama pitta dosha prakopa. So like that, dosha pramana, that is the degree of dosha vitiation, is we are going to analyze by this. Ayusha kshayam arishtaihi. So that means the Ayusha kshayam, that is the lifespan of an individual, we are going to analyze by the presence of signs of imminent death. Suppose if the person is having the breathlessness, in this way, by doing the 5 minutes of activity, then he is having the gasping as such, so that is indicative he may be having the shortened lifetime as such. Upasthita shreyastvam kalyanape niveshena. So that is the upasthita shreyastvam, that is what we can say, kalyanami shreyaskara marga anushtanena. In the sense, the intention to do the good activities, so that will be analyzed by the nature of the activities done by them. For example, treating the patients or educating the young students, that may be the activity of the medical professor, or fighting for the right cause, or fighting for the larger community. So that will be giving us the the good intention of a lawyer as such. Amalam sattvam avikarena. So that is, if the person is having the sthitadi, in the sense he is having the more amount of the loud voice noise is being present on the surroundings, and if he is able to do his activities consistently, calmly, that is indicative of the Sthitadi, that is the Amala Sattva as such. If the person is able to do one or two activities, that may indicate mild Sattva as such, or mild Amala Sattva. He can able to do his 4 or 5 activities. It may suggest Madhyama Amala Sattva. If he is able to do most of his activities, then it may indicate Pravara Amala Sattva. Pariprashna. So that is lastly the proper interrogation with the patient, such as the nature of the digestion, that is Grahani, regarding there whether it is properly functioning or not. Swapna Darshanam, that is the appearance of dreams, opinions, likes and dislikes, healthy and unhealthy diet, etc., that will be analyzed by interrogation with the patient. To sum up, Anumana Pariksha is the method of inference. Several pramana are being mentioned in the Anumana Pramana in case of the Charaka Vimana 4th chapter, such as Agni will be analyzed by Jarana Shakti, Bala will be analyzed by Vyayama Shakti as such. Anumana is being explained in Charaka Samhita as 2 types of the Pariksha, Dvividha Pariksha, plus 3 types of the Pariksha, Trividha Pariksha as such. Dear ANA community, that's all for today. What are the major key takeaways from today's discussion? Mention in the comment box below. And what is the one video that will be here in the coming days in this particular channel? Mention in the comment box below, and spread this particular video to maximum number of true Nidana learners, so that we can make a huge movement out of this particular small message. Dear ANA community, put a thumbs up and put a bell icon, so that the YouTube algorithms will fetch you the right information for the right time, for the right purpose, in the right way. That's all for today. Something more in the next video. Thank you.